Hello, friends and family. It is Saturday, January 5th, 2025. Welcome to the new year. Happy New Year, everybody. I am obviously in the hospital, so not starting this year out too great, but let's see. So, backstory. February 2024, I was diagnosed with stage 4 metastatic breast cancer. I had stage 3 back in 2019, 2020, went through treatment, was no evidence of disease for 3.5 years, and now it's back. So metastasized to my bones, and it looks like we may now have some soft tissue involvement in my hip, my right hip at least, and potentially into my brain and my lungs. So it's all kind of still up in the air. Like, I hesitate to even say that it could be in my brain and my lungs because I don't have a definite plan. But the fact that I'm in the hospital is alarming to a lot of people. But from what I've learned through my other metastatic breast cancer community is that inpatient hospital stays are not all that rare. So in my case, I have a couple days ago I started feeling numb in my lip, and then it traveled up my face, and then it was in my tongue, and then I was having like chest pain, and so it was kind of like all the hallmarks of like a stroke, right? And I have a history of blood clot in my port from the first time I went through chemotherapy, and so every time anything like blood related pops up, or vascular related, it freaks people out, and so I got sent to the ER. My oncologist sent me to the ER. They worked me up as best they could, did a CT. It looks kind of inconclusive at this point, so they did another one here inpatient, and then I had an MRI at like 3 o'clock this morning, and neurosurgery has reviewed it and said I don't need immediate surgery or anything, but they're gonna come talk to me tomorrow, between them and radiation oncology, to see which path we want to go, if surgical intervention is necessary or indicated. If it's not, which it's kind of sounding like it's not, then more than likely it'll be another course of radiation, but this time somewhere to my head. So maybe I get to shave my head again, I don't know. Or at least do like the cool undercut, edgy, dye it pink again kind of thing. But yeah, so the good news is my pain is fairly well under control. I'm really, really drugged, hence my voice probably sounds weird. But the pain is more or less under control. I'm in the hospital, and that's kind of my threshold is, that's where I make the decision to go home or to advocate for myself to stay, is that, am I confident that I can control the pain at home? And at this point I'm not. So like oxy wasn't touching it, and because nerve pain, so it's just a different kind of pain, and so they put me on all kinds of fun drugs, some of which I can take at home, some of which I can't. And yeah, we'll see what happens tomorrow when neuro and radiation onc come to see me, and we figure out a path forward. So I appreciate everyone who wants to visit. It's just difficult right now because I am on so many really heavy pain meds that I mostly just sleep, and like I have maybe 30 minutes a day where I'm like kind of coherent, usually right after I eat dinner, because I need to be coherent and walk around a little bit to let my food settle and stuff, and doing like some yoga stretches and all that as much as I can tolerate. And so honestly, visits are really hard for me right now. So, and plus I've got like all the specialties coming in and out, you know, of my room at random, and it's just a lot for any of you who've been inpatient for any amount of days. You know what that's like. So I do appreciate everybody's checking in and all of that. My dad has most of the information, or all the information that I have right now, and my boyfriend Mike has all the information. So if you guys have their information, you can always get it from them, what's going on, and you know, I'll update as much as I can when I can. But I'm at this point, I don't really have a whole lot of answers on the way forward. So yeah, we'll see what happens. But I'm coming up on just about a year since my since my stage 4 diagnosis. So I'm disappointed that it's only been a year, because in a lot of ways it feels like, it feels like it's been a really long year, and then at the same time it doesn't feel like it's been a whole year. You know how that duality works. But I'm disappointed that I have this progression and this issue, for a lot of different reasons. I'm terrified of having chronic pain, because I've experienced that, and I've been experiencing that, and I know pain is so like misunderstood and difficult to manage, especially within our current healthcare system. So looking forward to alternative therapies once I am officially retired in April. And also, I just thought I had more time. You know, when I was first diagnosed, I thought like how terrifying it was to say stage 4. But I was, you know, trying to stay optimistic and say, well, it's only in my bones. But now I don't think I can say that. And my biggest fear then was that it was going to go to my brain. And we still don't know. The CT was kind of inconclusive, and neuro didn't seem super worried about it. It does look like there's some soft tissue involvement, but I don't know if it's the bone, like the tumors in the bone, that are affecting the soft tissue, or if it's actual cancer in the soft tissue. So there is, and of course I'm not a doctor, so reading the reports is not helpful, and kind of sucks they can't really explain it to me. But neuro apparently doesn't think that my case is like huge priority right now. So I guess that could be a good thing, also kind of frustrating. And now that I'm like a little more coherent, and talking about it, I am getting frustrated that they're not even like just giving me an answer. I don't need to know, I don't know, I just need to know, is it in my brain or not? They also saw some nodules in my lungs, coincidentally, because they capture some of the upper chest when they do a head CT, and I think because I'm so compact, because I'm so short, that maybe that's why they could see it. I don't know. But yeah, they said there were some concerning nodules in the lungs as well. So we will see what that means. And for now, I am going to go back to sleep. My nurse will be in about 10 minutes to do the next round of meds, which is good because I'm starting to have a lot of pain right here again. It's just so strange to not be able to feel your face. But yeah, so I have no idea where this is gonna go, or where I'm gonna post this, or if I'm gonna post this. I don't know. I want to get the information out there. I don't want to freak people out, but I also, like, at this point, I mean, if you want to be freaked out, then be freaked out, because it's not I mean, it's scary stuff, but I am getting through it, and just, yeah, I'll come back with some like advice on how I, as a metastatic breast cancer patient, appreciate being talked to, and some ways in which I don't appreciate being talked to. So yeah, happy New Year, everybody.